Cloud。OK，那我们还是保持我们那个传统好习惯，就是准时开始。然后不过无论如何如果有晚到的，或者是比较晚才加入的那个朋友，我们都有录影，这都有录像，所以这个不用担心。从这个今天开始之前呢，我要先跟大家打2个广告。第一个呢是我们在很靠近的，就是5月4号接下来的这个DDW。我们在 San Diego 这里我们会有一个那个annual conference。这个 annual conference 是Chinese American Gastroenterology Association，就是我们 CAGA 的那个嗯的那个sorry。CAGA 的那个一个 annual conference，然后里面会有很多很重要的那个项目。那例如就是我们有一些就是很重要的议程讨论，然后还有我们年度的一些活动。那所以呢，如果大家有兴趣的话，非常欢迎。然后现场还有一些小组活动，然后这些小组里面。嗯我们也会就是 break down，然后如果对 fellowship 有兴趣，对 research 有兴趣等等的，都可以到时候在一起那个在一起那个讨论。然后在今年的十月份呢，今年的十月份，我们到时候会有那个北美华人医师联盟。然后北美华人医师联盟里面，在10月17到19的时候会有一个会议。那如果有兴趣的话呢，可以截个图，然后这边都会有相关的那个连接。好，那我这边先退出分享，然后那现在呢，我要跟大家花一点时间来介绍一下我们今天2个 speaker。那第一位老师是苗老师，他是那个1988年的时候呢是东北白泉医科大学，就是现在的吉林大学的那个毕业生。然后一开始的时候是在很有名的这个阜外心脏医院，然后做那个 cardiovascular anesthesiology 的那个住院医师培训。那后来2000年的时候，他过来 UT Austin 念的是那个neuropharmacology 的 PhD program。那后来就改成是那个 mathematical statistics，然后在UT Austin 2004年毕业。然后嗯接着呢，那个苗老师他是做在那 UPenn 做那个 clinical research coordinator。然后后来是在Geisinger Medical Center 做residency fellowship。然后完成之后，在 fellow residency 的时候很不容易哦，他做了那个Johns Hopkins 的 M.P.H 的一个 master degree，然后再加入那个GI。那 GI 的话Geisinger 结束之后呢，他本来是在那个Geisinger 当了1年的那个主治医师，然后就搬到了 Virginia，就一直在那个 LewisGale Medical Center。那2023年是我们LewisGale Gastroenterology Fellowship 的这个Program Director。那他这个苗老师同时也是那个American College of Gastroenterology 的 Fellow。那第二位讲者，我们等到那个苗老师讲完了，我们再开始啊。好，那我们先请苗老师做分享，好吗？
大家好。今天这 topic 就是比较轻松一点，我们那个也不是专业的这个讲座，我们讨论跟那个 GI Fellowship Application 有关系。那我很荣幸的被邀请到来讲这个跟Fellowship Application 有关的情况。嗯，这个因为我们就主要的 aim 呢，我们就是这个 IMG International Medical Graduates。 一下，我好像不能，我这个在这儿，OK。那我们知道，GI 的，我不知道我们这个听众里边有多少是现在的internal medicine resident。那就是我们这个GI 的话是一个很有意思的一个专业，very very interesting specialty. We are in charge of the whole GI tract from esophagus all the way to the rectum and anus. We work with the pancreas, stomach, small bowel, liver, and colon and all that. We can do colonoscopy, upper endoscopy. For people with special training, we can do EUS, ERCP, and a lot of other um, tests and procedures. 那这个 slide 我们在讲有关于gastroenterology shortage. This year in February, Dr. Loftus actually published this paper, estimate that in 12 years, in the whole country, there would be about 1,300 GI doctor shortage. To give you an idea, we probably have about 300 graduates every year from the fellowship. And every year we have a lot of people retiring. So with this shortage, the current training would not be able to backfill the position. So therefore, without expansion of postgraduate training spots, it seems that the shortage can only be worse with time. And then somebody estimate that right now more than half of the GI providers are older than 55, and a lot of people retire around age 60 to 65. At the same time, the demographic wave of the peak Medicare, the baby boomers, and the reduction in colorectal cancer screening age to 45 ensure that demands for our services will remain high. 就在5年前的时候，我们colon cancer screening age 降到了45岁，所以呢，我们在这个等待做 colon cancer screening 的病人就更多。International medical graduates in the U.S. physician workforce. The estimate is about 25% of the U.S. physician workforce is actually international medical graduate. In the internal medicine world, the percentage is obviously much higher. I don't know the exact percentage. The IMGs are more likely than US graduates to practice in underserved area and treat the racial and ethnic minority and lower income populations. We all know that a lot of the IMGs require visa sponsorship to participate in graduate medical education. The route that is most taken is actually a J1 visa. And the process obviously is easier, faster, and cheaper, but J1 has a lot of problem. In the residency programs, even though the IMGs actually have similar or even higher USME scores, they are more likely to get into the community-based programs compared to the US medical graduates. The US medical graduates, they are more likely to get into residency in the university hospital-based academic programs. We know that the majority, I would say a majority of the community-based programs provide excellent training, but there can be fewer interactions with the GI faculty. Compared to the academic programs, the community programs traditionally also have fewer resources to do clinical research, not even mention translational research. So therefore, cumulatively, these factors might render the IMGs less competitive for GI fellowship. And we can see this in the GI fellowship application. For the IMGs who actually got into the GI fellowship, there might be additional funding restrictions because of the visa status. If you want to do research if you want to actually do a lot of research, there's a lot of funding restrictions. And there's also something called the J1 visa. If you have a J1 visa, you finish your training, you are supposed to go to an underserved area for 3 years. And this actually is very beneficial for the underserved area population. But in terms of application to the specialty fields such as GI, it obviously restricts a lot of these doctors. 那我下面来讲一下，就是我自己的就是申请 GI 的这个过程。我在1991年的时候，我是山东人。那1991年呢，我就当时是被那个白清医大录取。现在白清医大呢是属于是吉林大学的一部分。我当时我是坐了18个小时的火车，但当时火车是很慢。And I was in the 7-year program。然后我毕业了以后呢，我就去到北京阜外医院，他们当时有一个麻醉科的住院医生制度。当时的时候，这个住院医生制度是一个就是特别新的一个 program。我们当时的我们 department chair 呢叫刘进教授，他是从美国Southwestern 回到中国，他就开始这个 program。他后来等到我出国的时候，2000年他就搬到了华西医大去做更大的 program。那然后2000年的时候呢，我就开始去 UT Austin 做 PhD program，做的是 neuropharmacology。当时的时候the main focus is actually the neurophysiology for anesthesia and alcohol。但是我做了2年以后，我就决定不再 pursue 这个 PhD program。所以我就switch 到了 mathematical statistics。到2004年呢，我就拿到了一个 master degree。这个时候呢，我就开始学习考 board。所以在2004年我毕业了以后呢，我们就搬到了费城。这样呢，我在2003年到2005年这个断断续续的这个过程中，一边就是读这个 mathematical statistics。后来又一边工作，我就把这个USM step， 我就把这个 3 step 都考完。然后我有一个机会呢，去 University of Pennsylvania， 他们正好有一个在他们的 IBD Center 有一个 Clinical Research Coordinator 的机会，我就去那儿工作了大概1年的时间。然后呢，我就联系到去做 resident。所以在2006到2009，我就去 Geissinger Medical Center， 它是在 Danville Pennsylvania， 就是在 Central Pennsylvania 那个，我在那儿做 residency 做了3年。那我给我的母校做一下广告啊，我的母校就叫白清医科大学，现在吉林大学白清医学部。那你再看这个左上角这个照片呢，是实际上基础医学院。那你看这个大楼的前面是有一个白求恩医生的雕像。这个大楼呢，在伪满洲国的时候是他们的国务院大楼。我们学校当时最开始是一个军校，所以军医学校，所以他就是在这个夺回长春以后呢，他就首先进来以后，他就占领叫伪满8大部，所以现在是属于旅游景点。你们也会去长春的时候应该去看一下。我每次回当然要回这个地方要看。然后下面这个照片呢是北京阜外院的照片。那是我们就是号称我们是全世界最大的心血管病的医院，专科医院。那我在做完了 internal medicine residency 以后呢，因为我当时我是参加了 Johns Hopkins M.P.H program， 因为当时有个 scholarship。我就又做了1年叫 General Internal Medicine Fellowship。这个时候呢，我就做了一些个 clinical research， 在学这个 M.P.H， 然后做一些 academic hospitalist job。在这个过程中呢，实际上在这1年里，我就做了很多的 clinical training in hepatology。所以在我这个 fellowship 毕业以后，GI department hired me as the hepatologist, seeing patients in the clinic and also in the hospital。这样在2012年的时候呢，我就开始我的真正的 GI fellowship training。到2015年毕业以后呢，我就留在 Geisinger 做了1年的 attending。然后在2016年 因为 Central Pennsylvania 实在是就是冬天很长，通常就是说，Thanksgiving 肯定要下雪，等到Easter 这个时候还有可能会下雪，所以我就因为冬天很长，我就搬到了这个 Virginia，在现在的是 Southwest Virginia，我们这块是 Roanoke County，工作的地方叫 LewisGale Medical Center，它是属于 HCA Health System。这样2016年然后2017年我们 Medical Center 开始了 Residency Program，等到2022年呢，我们就got approval for a GI Fellowship，等到2024年我们就开始了我们那个第一届的 GI Fellowship。这个 GI Fellowship Program Director 实际是属于是吃力不讨好，呃，做很多活儿，但是我还是非常的 enjoy 做这个工作。我们现在呢是今天早上我刚去跟从 Chicago 来的我们其中一个 fellow 见面，他过来找房子看一下。那这个 slide 上面就是有这个4个地方我在美国去过的地方。这个左上角是 UT Austin，very beautiful campus，然后这个右上角呢就是 HUP，就是 Hospital University of Pennsylvania，那我在这儿做了1年的 Clinical Research Coordinator，这个就是我奠定了我要去做内科，然后就做消化科的这个基础。我原先的时候我实际想要去再回去做麻醉科，但是做了1年的 Clinical Research Coordinator，我联系去到内科做 Resident，然后呢，然后就去了做这个 GI。下边这个左下角是 Geisinger Medical Center，然后这个下面右下角这个就是我现在工作的医院。我们这个地方是在 Blue Ridge Mountains，它后边全都是山，是一个很漂亮的地方。So when I think about my pathway to GI, I feel that the clinical research has been very important. Specifically, the paper I published with the University of Pennsylvania professor, Dr. Jim Lewis, was very important. Even though I was not the first author, I think it's important for me to get into residency and even later onto the GI fellowship. The second part is become very familiar with the GI faculty. I was the apprentice with the transplant hepatologist there, who happens to be the GI fellowship director. And then as the residency goes, build the academic strength, including the clinical research and pursuing my M.P.H degree. Um, Lastly, I think the H-1B visa was important because if I got a G1 visa, I probably will have to go somewhere um, uh, because a lot of places really don't offer J1 visa for fellowship. But I actually passed the step 3, and that actually qualified me to get an H-1B visa, and that carried me on all the way to GI fellowship, and then after that is the attending, and then green card actually. So it was a really good strategy there. On this slide, I am going to talk about some helpful things to do during residency so that you can apply for GI fellowship. First of all, I think you should do as many GI rotations as possible as you're allowed to do during the residency. The other thing is that don't take any vacation during the rotation. If you want to apply to that specialty to GI and you take 1 week vacation during a month, that doesn't look good at all. Second thing is that you want to get involved in clinical research projects really early on during the residency. Preferably, you can be the first or second author. If you're working with a fellow, of course, usually you are the second author, but that's good enough. Then, if you are in a hospital where there's a GI fellowship, you want to really make friends with the current fellows because they know the details of the program. And you want to make sure that the GI faculty members actually know you, especially the program director. And also try to attend as many GI lectures as possible. That really shows that you have strong interest in GI. my short experience as the GI Fellowship Program Director, we started the application process. We got approved, and then in 2003 we had the interviews for the fellowship. Our program, our hospital is a 500-bed hospital, is a medium-sized community medical center, but is a tertiary center in terms of referrals. We have a lot of transfers from a lot of the smaller hospitals in the Southwest Virginia region. The first year we had, I remember, it's about 300 applicants. And then this past year, we actually had 360. And we had a filter, people who are not eligible for interview. We filter out. I did not even look at the application. So this past year, I actually went through 220 applications in detail, and that's for 2 spots. And our protocol, we do interviews for 10 candidates per fellowship spot. So we actually interviewed 20 candidates. All the interviews are virtual, but we do offer site visits for people who are interested, and we also feel that they are pretty good. And this past year, we did have 5 candidates actually came over to have site visit. With our program being a community-based program, we do prefer the applicants who graduate from the residency 1 to 2 years with 1 to 2 year working experience. And lastly, we don't sponsor any visas. So when you look for programs, you want to make sure they actually sponsor visas. Otherwise, you're just wasting your time. These 2 pictures on the slides, the left lower is called a Roanoke star. It's a huge star in one of our little mountains here, and it light up in the evening. Is very pretty. The right lower panel is called McPhee Knob. We are in the Blue Ridge Mountains area. It's the Blue Ridge Parkway. And the hike to this side is really good. And the side, once you are there on the rock, it is magnificent. If you come to visit, you definitely should try to go to these 2 spots. And there are a lot of other places you can visit. Our area is really beautiful. So let me talk about the things that I look for in an application and a resume. First of all, I look at a good US LME score. The score should be at least around 220, I would say, for step 1 or step 2. Anything lower than that, we usually don't invite. For the score lower than 200, I think there will be trouble getting interviews. If there's a failed test, that's trouble, and that's a big problem in the application. If you have graduated from the residency program, you want to pass the board. If you graduate for a couple of years already, you have not passed the board, that's of course is a red flag. And I also look for clinical research projects, including QI projects. You don't really need to do the landmark papers, big papers. Any project, as long as you really are doing that, is good. The other thing I look for is actually leadership skills. If you are a chief resident, for example, that's important. A strong recommendation from GI faculty is important. You want to have very meaningful interaction with this faculty to have a good recommendation. We also look for things that point to good personality. For example, for people who actually go out to help people out, go for charity or volunteer opportunities, stuff like that. So that's important. Now, things to avoid in the application, I find people put in the honors that they got in high school. I think that's just too remote. College honors, maybe. The second thing is that do not exaggerate your effort in research projects. If you are listed as 3rd, 4th author in the project, you cannot say that you did majority of the work in there. The third thing is about the case reports. A lot of people pile up case reports of case. Sometimes I see 10 case reports. Even if this is all related to GI, is not as important as a research project. Lastly, recommendation letters from this year, not from last year or a few years ago. If you have a recommendation letter from the time you apply to residency, that look really, really bad. You really want to get recommendation letters from this year, dating maybe May, June. That's very important. For personal statement, I think personal statement is a very important piece of document. In the personal statement, you want to have a really good personal story of why you're pursuing a GI career. You want to describe your research projects very clearly, and you want to show your leadership skills, and the teamwork spirit. That's all very important for us to consider as an applicant. If you have good and fun hobbies, you can list it, like traveling, hiking, dancing, things like that. Um, I don't like long personal statements, so one page is good enough. Typically, 4 paragraphs, that's good enough. Things to avoid in a personal statement. As I mentioned, if the statement is too long, 2 pages, I really cannot finish it because there are too many candidates to review. The research projects, don't do 1, 2, 3, 4 projects. Just pick one best project and describe very nicely. And also personal health history, you can mention that you had Crohn's disease, but don't put in too much detail. I think it's a very sensitive topic there. Um, the other thing I find interesting is I call it not so helpful hobbies. The things that you do, either too risky or too expensive, in my opinion, is not good. People say I'm a skydiver, or they travel to exotic places. I don't think those are good things to put into the personal statement or resume. Interview tips. Once you are accepted for interview, you want to really do research for the area, the hospital, and the faculty. Especially for the faculty, you want to go to their website, look at their specialty area, what they are interested, look at their research and all that, so that you really can carry out a very good conversation with them. Then you want to have a very clear presentation of your best research project. Um, and they usually ask you about a question why you are choosing GI. You want to have a very convincing story. Really avoid the topic about money. If you say I go to GI, I can make money, that's really, really bad, of course. And then if you have some sort of failure or gap in your resume, you really want to have a good explanation. Let's say that you have a step 1, 240, and step 2, 210. You really want to explain why your step 2 actually, compared to step 1, was so bad. And then you want to really prepare questions to ask the interviewing faculties, especially the ones that are relevant to their specialty areas. That will be really good and leaving them very good impression. So what to avoid during interviews? These are virtual interviews. I think in the foreseeable future, we will still do the virtual interviews. It saves time and money for all the people. But because even though it is a virtual interview, you still need to wear really nice clothes. Don't wear casual clothes. Sometimes I see people wearing a t-shirt during the interview. That's not good. You also avoid asking questions about working hours and the caseloads in the program. And when you ask things like that, that tells us that maybe you are not a hard worker. That's the problem. Showing too much interest in the program is not good. I have had people telling me that I will rank your program #1. That's not good. It's questionable. And the other thing is, don't exaggerate your effort or your achievement. Don't talk too high of yourself. Try to be humble in the interviews, of course. I think that the last important thing to avoid is don't talk any bad about your own fellowship program. If in your hospital there's a GI fellowship program, that's probably the one place most likely you can get into for fellowship. So speak very highly of the program, but say that you are also interested in other options, of course. So that's pretty much of my talk, a very short summary. GI is the most rewarding specialty, in my opinion. Of course, I've been doing this for more than 10 years. But the good thing about the specialty is that we have really good medicine and we have very exciting procedure aspects. There's a bright future, as I presented in the beginning. There's increase in job market demand. When you prepare for the application, you want to build a very strong application from the very beginning of the residency. You want to spend a lot of time working on your personal statement, and you want to get very strong recommendations from a GI faculty. Lastly, don't forget to sharpen your interview skills. I wish best luck to all the applicants. Thank you very much.
Thank you very much, Dr. Wang. And we'll have the Q&A panel discussion after Dr. Wang's talk. And then, yeah, thank you, Dr. Miao again. So our next speaker, Dr. Iris Wang, she's an assistant professor of in the Division of Gastroenterology and Hepatology, Mayo Clinic, Rochester, and she's the associate program director of the GI Fellowship. And then in addition to general gastroenterology, her interests of her area of clinical focus include disorders of gut-brain interaction, including irritable bowel syndrome, functional dyspepsia, and chronic abdominal pain. And her research is focused on the pathophysiology of DGBI disorders and testing of the non-pharmaceutical therapies, including hypnotherapy, digital therapy, extended reality therapeutics. And Dr. Wang previously presented a very insightful talk about the application of the digital medicine in GI, and her talk at the Curb Insider Internal Medicine about constipation, diarrhea has been a source of practical information in a happy and fun learning way. So 按照华人来说，就是这个是大家奉为圭臬的那个所有那个 medical residents 都应该听的那个talk。那话不多说，我们请艾尔斯王来那个。
Thank you for having me. Let me share my screen. So thank you so much for the opportunity. There's a lot of people here applying to GI, so I don't think we have to convince any of you that we are the best subspecialty. I will give you some disclosures. So I came to the States in elementary school, 所以我从小就在这边长大，我在这边上的学。I am a U.S. medical grad, not an IMG. And so I won't go through my journey very much. I think Dr. Miao's journey is very commendable, as are all of yours. I had an easier path. I have been the GI APD for now 2 years, and I've gone through 2 application cycles. But before that, I've been interviewing for internal medicine residency for 4 years, so I can speak from my perspective. But all of this is my personal experience, my personal opinions. They do not reflect my institution. They do not guarantee anybody's success. 只是我总结一下我自己的经验、自己的想法而已，希望有帮助。It seems Dr. Miao and I have coordinated almost because we are talking about similar things from different perspectives. But I want to share the landscape from a more dismal standpoint. GI is in shortage and we need more excellent physicians, but GI is extremely competitive. There are 727 GI fellowship positions with a 99.6% fill rate as of our last match. That is a 65% match rate. That is the most competitive of the IM fellowships. That means 65% of those who applied for the match and received an interview actually matched. So 65% of the people who created a rank list actually matched into GI. I don't have I tried to look for the data for IMGs, I could not find them, but approximately a quarter of all US doctors now are IMGs. And as you all know, and as Dr. Miao talked about, IMGs face extra hurdles, the visa, training variability, etc. But hopefully what Dr. Miao and I are telling you is that with strong strategic applications, we can overcome these hurdles and put all of you very, very well-trained physicians into the GI workforce. But for all of you who have matched internal medicine and are currently in residency, I want you to think that the game has changed, okay? You are in a very different position now as an internal medicine resident than you were as a medical student IMG applying to internal medicine. You are now training in a US residency, whether that is community or academic, it is a US-based program. You've spent time living in the US, and therefore you now have bargaining power, and you have to remember that you bring value to this training program that you are applying to and interviewing with. You are not who you were. You need to show me what you're capable of and who you are now, and why I need to interview you and have you as one of my fellows. How are you going to do that, right? You excel. You are the best IM resident you can be. You show us that you are able to excel in a US training system. Take on leadership roles like Dr. Miao said. If you can be a chief resident, be a chief resident. Take on first author papership roles. And make sure that you don't ignore your evaluations, right? The things that people are saying about you. It is really nice to get feedback that says, oh, excellent doctor, great job, read more. Those are useless to you, right? They do not make you better. They do not make you grow. And so push your attendings, your senior residents to give you critical feedback, right? And so that their evaluations can be beyond just a standard, he was a good resident, he was a hard worker, right? We see so many of those and they do not stand out. So you want to be stand out and you want to figure out how to be stand out. Don't ignore your ITE scores. Those in-training exams may not mean very much. They don't count for your boards or anything. But if you do really, really well in them, it sometimes makes it into a PD letter that you scored, first percentile in an IT, or you were the highest ITE score rate, ways to stand out. Take opportunities to ask for feedback and grow from them. Be a great doctor, right? Ultimately, I am trying to train really great doctors, and I need people who are really well-trained clinically so that I can teach them GI. If I also have to teach you internal medicine, I can't teach you GI at the same time. So show me you're a great doctor. We talked about commitment to GI. This is so important. Join interest groups, attend grand rounds. If your local GI doctors have no idea who you are when I ask them, it's a sense of flag, right? That maybe you aren't as committed or interested. Get involved early, and then find your mentors in GI, whether that's at your institution or even a nearby institution, who can sponsor and promote you as an interested trainee. Some of you may know Mohammed Bilal, who's somebody at the University of Minnesota. He was the associate program director there. Every DDW, he takes all of his trainees who are applying to GI and walks around the poster hall, making sure they meet every single program director he knows, right? That is a mentor, that is a sponsor. And if you can find somebody like that to promote you, that is a huge help. If you can't find someone like that, have them do it in writing. Strong letters of recommendation that really aim for quality, right? If, Dr. Beauchene, who is an amazing, high-ranking, very reputable gastroenterologist, you get a letter from him that says, I worked with him on consults, he was a good resident. That's not going to mean very much to me, as opposed to somebody who you know well and they can write about how hard you worked, what patients you took care of, your backstory, why you're an amazing person. That's going to mean a lot more than somebody who has a good name but maybe doesn't know you, right? So don't feel like you need to always ask for the highest ranking person to write you a letter. Ask for someone who knows who you are. Be present at these national meetings. There's so many opportunities to network with GI physicians. But when you go to those meetings, don't just stand next to your poster. Have a networking plan. There are so many trainee-focused events at each of these now. Meet the other trainees. And like Dr. Miao said, meet the fellows, because those fellows are about to become attendings, and they're about to have a lot of sway with their program directors when interview season comes up. So if you can make friends, they are the ones who can put in a good word for you, potentially, right? And then don't forget your local internal medicine meetings. these regional meetings have opportunities for oral presentations, and that looks really good on your CV. When your application is your story, right? Like Dr. Miao said, we read so many. We have a fellowship, just briefly to tell you, of we match 8 GI fellows for the general fellowship per year. Last year, I screened more than 500 applications. We do not use filters, and so I read every single one of the applications along with my program director, which means that I read close to 300 personal statements and applications, right? I don't have time to read everything in detail. But what stands out is somebody who knows who they are and writes that strong personal statement, because I read all of them. So take that space to tell a story. Tell me who you are. Tell me a compelling story of why I need to interview you, why I want to meet you as a person. Show me your resilience, your adaptability, this story of how far of a road you have traveled, and convey your passion for GI. These are the people that we want to interview. Like Dr. Miao said, avoid cliches, right? Don't try to make it too fancy. The best personal statement advice I've ever gotten is aim for 80%. There's 10% of personal statements that we read, and they are so mind-blowing that you have to meet this individual because that story was so good. But trying to write that story risks putting you in the other 10%, which is a personal statement where I read it and I say, I don't want to meet this person. Or there's something in there that you tried too hard and it came off weird. How do you aim for the 80%? You write your personal statement and then have a lot of people from different areas and backgrounds read your personal statement. It can be very vulnerable. It can be very scary to do that. And you're asking people to help, right? But you need to know how the words sound to somebody else reading them. And there's no other way to do that than to have somebody else read them. On the application in ERAS, there's a lot of space for experiences, but there's only 10. And then there's one space for a meaningful experience. Think hard about how you use that space. Do not waste it. Do not leave that blank. Think hard about showcasing what you've overcome. A lot of the research trainees who are IMGs who work with me, when I read their applications and I say, why didn't you put this on your application? They tell me, well, everybody else has been through this, and so I didn't think it was that hard. I didn't think it was that hard that I had to, work multiple jobs to put myself through school. I didn't think it was that unusual because everyone around me was doing it. But that doesn't mean everybody who was raised in the US, went to school in the US, had that experience. And so, and that experience shows me how resilient an individual is. And so this is not the place to be humble about what you've overcome. You don't have to brag about it, but make sure you showcase what hurdles you've had to go through. This is also a really good place to address any gaps in your application. If you did have that low STEP score, talk about why, what happened, and how did you fix it, right? Don't try to bury it and think that we're going to miss it, right? We're going to catch it sooner or later, so that better you address the issue head on, the better your chance will be. But to tell your personal story, right, you have to know who you are. You have to know what your strengths are. And then you have to be able to convey to me what strengths you bring and what you are looking for. And I think this is so important because as trainees in medicine, we are always asking. You're always asking for an interview. You're asking for the opportunity. You're asking for the next position. And as an IMG, you are taking opportunities that come, no matter what they are. This is not the time for that, though. You cannot just take, because it doesn't showcase what you bring, right? So you have to take some time and be willing to brag about yourself. What does your mom brag about you about, and particularly for Chinese background, right, and like Asian heritage, that's so hard, right? We're not allowed to claim that. We're not allowed to brag about ourselves. So what does your mom brag to her friends about you? What are those things that you are so good at, right? And what are your strengths that you bring? And that's what you convey in your personal statement. And then know what you're looking for. And think about, does my program match what you are looking for? Because if it doesn't, and you try to make that fit, it shows very clearly that you're just trying to get a residency spot and you don't care about which program you match in. And even if that's true, that's not the story you should be telling on your interview day, okay? This is the time for critical reviewers of your personal statement. These people who will be so mean to you and rip apart your personal statement are your best friends. You don't need somebody reading your personal statement and saying, oh, good job, it looks great, right? You need people to say, okay, this doesn't make sense. This doesn't read well. You need to clean this up. This is too much. This makes you seem, X, Y, and Z, right? You need those people in your team as you're preparing for this process. Publish or do whatever it is you do, any of your achievements with a purpose, right? This goes back to like knowing who you are and what you want. What is your passion? Because if you don't have one and you're just publishing to get into fellowship, it shows, right? Even if you don't care about research at all, you have to care about your project. You have to be able to tell me why it was important that you did what you did. And you have to be able to tell me what you did, right? If you can't explain the purpose of your research, it looks worse than not having done the research at all. And so if research and publications aren't your passion in life, that's okay. Do something else, right? Show me that you can do advocacy, education, community service. All of those things are really important as leaders and as future gastroenterologists. But whatever you do, do it really well, do it with intention and accomplish something, right? If you're going to teach, don't just teach a medical student one time. Don't just say that I love education. And so every time I get the chance to teach a med student on rounds, I do that. That's fine. That's part of the job. I expect you to do that. Did you develop a curriculum? Did you develop a new lecture and a new way to teach a medical student a topic? Did you develop a community patient-focused education series so that you can increase colon cancer screening rates, right? Take it that next step and have a product that you have worked towards, because it shows me that you can accomplish something and you're somebody with a passion and a drive to get something done. It's better than just writing like 4 case reports, that then you present and never publish, right? 1 or 2 GI publications can help. When you are publishing, it shows me why do I care about your publications, right? Especially because a large percentage of graduates of GI go into private practice and not ever do research again. So like, why do we care so much about these publications? 1, it sets you apart. But what I think it shows is that through the research process, you develop this ability to think critically, that you have some research experience so that you know what you're talking about, especially if you're going to be interviewing at an academic medical program where you're required to do some sort of research, right? At my program, we give you an entire year to do research. And so I need you to have some research experience and that you'll actually like the research process. But most importantly, we're looking for follow-through. We're looking that you can develop a project and then take it to completion, right? So then it doesn't help for you to start 5 different GI projects and not finish a single one. Focus on having 1 or 2 manuscripts in press. Think about, Dr. Miao mentioned all these abstracts, right? All these case reports are less impactful than 1 good manuscript. Think about how many abstracts you have to a manuscript ratio. If you have 100 abstracts and 2 manuscripts, it actually doesn't look very good at all for your application. So don't think that it's just about the numbers. And you must be able to talk to me about your project. You have to show me that you did something, right? You have to own it. Why was it important? How you might continue this work and why? And what did you actually do, right? Don't tell me, oh, we did this work and then, oh, well, I don't know what the statistician did. And actually, I don't know why we studied this question, but this is what we found. And you're just reading me your abstract. That does not show me any of those 3 things, right? It doesn't show me you can think critically. It doesn't show me that you actually learned how to do research, and it doesn't show me any follow through. So focus. It's it's not about numbers. It's about quality. We want what you call like Jinghua, right? You want really good quality, if you can. Apply strategically. If a program does not sponsor your visa, don't apply to that program. There are signals coming to the application process in GI. We don't really know what to do with them. What do these mean? So last year, there were geographic signals where you can tell a program, okay, I really want to be in the Midwest. I really want to be in the Northeast or on the West Coast. And you list whatever reason. Think about how you're going to use them. Because this year, so in addition to geographic signals, this year there will be additional program signals. Internal medicine started that, I think, 2 years ago now. There will be, from what I hear, gold signals and silver signals. None of the PDs, I don't know if Dr. Miao, you have a comment on this later, know really what to do with them yet. But use them wisely. Do not signal a program if they're not IMG friendly, and definitely don't apply if they don't actually sponsor the visa that you need. So use them, strategize with your local GI folks, your GI mentors, and if you don't know where to strategize, come to CAGA and we will help, hopefully. The interview is so important. There's so many stellar IMG applicants who make it to the interview process, and nobody has coached them on how to interview, right? Do not be that person. Interview like you are going to be a future colleague, like you are interviewing for a job. Be personable, be humble, be team-oriented, dress respectfully, professionally. But humble does not mean subservient, right? So humble does not mean you are not begging for a job. You are not begging for anything. You are not, you are being recruited, right? And so do not be arrogant, but do not kind of diminish your own accolades, accomplishments. Do not just offer to help the team. And we want people who are their own person, who have a goal, who have a purpose and a passion. And I want to know how I can help you be the next leader, how I can help you be a strong physician, right? Don't just say what you think I want to hear. Say what you truly believe. And again, do that soul searching and thinking and talking to people so you know what you want and what you believe. Prepare for those behavioral and clinical questions. Yes, why would you want to do GI? Why GI, right? But also there are a lot of now kind of these behavior assessment questions that we will ask on the interview trail at many programs, including things like, tell me about a time of failure, time of difficulty. These are all over Student DoctorNet. Look them up. You should not be surprised and unprepared for these questions, right? Make sure that you have answers prepared. And then ask thoughtful questions about the program. Make sure you do your research, like Dr. Miao said, about whoever you're interviewing. And do not ask questions that have already been answered, right? That is one big mistake to make. If the program directors or the chief fellows have gone over this in a presentation, don't ask the same question. Instead, ask for clarification. Oh, I saw that you said in your presentation X, Y, and Z. Can you tell me more about that? Or can you explain to me this aspect? It shows me that you were listening and that you care enough to ask more. If you have an area of focus, ask for interviews or meetings with potential mentors. So you have to look up the institution ahead of time, right? If you're interviewing with Dr. Miao and you have an interest in hepatology, make sure you say that. Prepare for both virtual and in-person interviews. So there are some programs that are going back to in-person only interviews. Our program is not, and we are doing that kind of in-person site visit after the interview, after our rank lists go in. Happy to talk about that. But prepare for both. But the vast majority of interviews are still going to be Zoom, and you want to really optimize that environment, right? And so I took this series of photos, embarrassing, to show you guys what you should not do. So make sure you set up your background, lighting, camera. There are a lot of videos online for common interview mistakes. Please watch them and think about kind of making sure you're not doing any of them, because sometimes you don't know that it's a mistake, right? And practice with a friend, and then with a colleague, and then with somebody who interviews, right? So that, and you want people who are not nice. You want people who will pick apart your interview, make you start over, make you practice, because you get this one shot, right? Not to make anybody nervous, but the interview kind of helps because you're all stellar applicants, right? We're interviewing you because we think that you will match well at my program. And so the interview really helps determine where on that rank list you are going to end up falling. And so it is really important that you're able to present the best version of yourself, that your lighting isn't causing trouble, that you're not getting distracted because of your background. So let me show you some issues, right? This is me earlier today in my room here. This is my very not professional room that I use as a home office. This is not ideal for interviews because the blurred background, you see what's happening? Like as I move in and out, parts of me disappear. And then you see flashes of my background, and it is very distracting, especially because I talk with my hands, and then so my hands like disappear in and out of the screen. Don't do that, right? You don't want that negative impact. This is me where my screen is now over here on my second monitor. And if I do that, like I'm making eye contact with my interviewer, but you guys aren't seeing me make eye contact anymore. And now I look like I'm not really paying attention to you, even if I'm thinking. I can see if you are reading off a screen. It's very clear what your eyes are doing. So make sure that your interviewer screen is right below your camera. And then you are looking at the camera and not the screen as you are talking. So you're maintaining that positive eye contact, and it's really sending a good, personable message, right? So don't do that. This is poor lighting, right? You can see how like my face just looks kind of weird and I look kind of like uninterested and dull, right? That's all my lighting, right? What a silly thing to have make me not look interested. And this is if the room is really light and I'm using some sort of weird lamp, not good. Bright, well-lit space, interesting things in the background or something blank, right? Learn from Dr. Miao's background. It is beautiful, not mine. I usually do my interviews in my office, right? Where I strategically put things in my background so that if I ever run out of things to talk about, there's something in my background. And I love it when applicants strategically put books that they are reading, art, something so that there's something to talk about, right? Especially if you are an artist and you have paintings, put that in your background and say, oh yeah, I like to paint. Here's an example. And it's like a really nice talking point to say, hey, I'm a person, right? That I can talk to, that you can talk to. I will end there so that we can have some maybe brief time for questions. Hopefully that was helpful. Best of luck to everyone. And we need you in GI, so please apply.
Thank you. Thank you both speaker for the very insightful, very informative, comprehensive talk. And I welcome any questions and comments. And feel free to type in the chat. I'm a little curious about Dr. Miao's mention about there are some filters in the program that because of that, then some of the candidates were not even reviewed by the program director. What are the red flags or hard rule? I know it doesn't really apply to every programs, but then just kind of a hint for other candidates, just not to.
So for us, HCA as the company, the education program, they actually have a standard where, for example, the US MLE should be above 200. I just give a number. I don't know exact number. Or the graduation date should be within the last 5 years, for example. Those kind of things they put in the filter so that some of the applicants, if they are out of that criteria, they are actually filtered out. Of course, if I want to actually see all the applications, I can, but in the system, we can use the filter so that the ones we won't really rank, I don't really need to see those applications. That's the filtering.
Gotcha. And we do have a questions on the chat. Do basic research publications during PhD or postdoc matter for the application? Open to both speakers.
I would let Dr. Iris Wang comment on that. For us as the community-based program, the basic research part is not that important. It's just so that you are very, very capable. But you actually have to do explanation why you did a lot of the basic research and then you actually switch to clinical medicine side.
So for us, it depends a lot. Like if you are applying for an NIH-funded T32 track so that you can continue to do that research, absolutely, it matters a lot. And the quality of that research and how well you can tell me the next steps and the next plans for that research, it is very, very important. But if you're not applying to a T32 and you are no longer doing basic science, it's still important because it's your background and it tells me kind of what you've overcome, right? Because there's so much difficulty in being a basic scientist. But then you have to do what Dr. Miao said, which is tell me why you are now switching to clinical medicine.
And we have a second question about any advice you can give about how to address a high year of graduation.
You talk about you have graduated a long time ago.
Yeah, I would assume that they are referring to people who have done like PhD or even postdoc fellowship and then have graduated from med school for some time, some years, and then applied to internal medicine, then GI.
Yeah, I would say it's the journey. I always say whatever you do, it will not get wasted. Even if you work in the lab for 5 years, you had your PhD degree, that's very, very commendable. But the longer you were away from clinical medicine, the more you will have to explain what changed that you actually considered switching from basic science to medicine. Of course, a lot of people from China went through the PhD program and then applied to residency, or some people went through PhD, did the postdoc training, get the green card, then decide go back to clinical medicine. I mean, you just explain what you did. I don't think that's anything bad. You do need to make sure you can tell people that you are still pretty good with clinical medicine. Of course, when you apply for fellowship, that's not even that's not a problem anymore because you are already doing the internal medicine training or you're already practicing internal medicine. So I think for fellowship training, it was not a big problem.
Yeah, I will say that we look at the IMG status very differently in fellowship application than we do in residency application. In residency application, this high year of graduation, what have you done in the meantime, is looked at so much more closely. Whereas, like Dr. Miao said, usually for fellowship applications, you're coming right out of some sort of clinical training and residency. There are individuals who have done multiple cycles of applications, right, and maybe weren't successful out of residency and so are doing hospital years or research fellowships, etc. I think it's worth explaining, but also it's really important to say, okay, so how have I changed from the last time I applied? What new skills do I have to offer, or what have I learned? Is it more publications? Is it more research experience? Is it more education experience? Is it more clinical experience? And you have to have best to have letters of recommendations to back up what you are saying that you have accomplished.
Right. I know we're approaching the end of the speak for today. Quick question carried from the previous talk that we gave on the 30th March, that for people who had quite a few years of graduation from their residency, have been doing hospitalists for a few years, any advice that they can help to strengthen their overall statement?
So
go ahead. You go.
Yeah.
I will talk after you. Yeah.
I will say sometimes it's very difficult to assess how good you are clinically at that point. And so I always look for some sort of letter of recommendation, right, from a colleague or your division chief or something that tells me about how you are clinically as a hospitalist. Continue to publish and stay within GI, right? I want to see that you're still trying and still interested in the field with collaborations or networking. And then the other thing that is worth considering is one of the non-accredited fellowships in GI, right? Either transplant hepatology year before general GI, or now there are so many of them. There are motility years, there are pancreas years, neoplasia, etc. It's not the right path for everyone, but for people who need more clinical exposure to GI and more validation, like a letter from a GI clinician, those can be quite helpful. Yeah.
Yeah, I would say hospitalist work, especially academic hospitalist, not the community-based hospitalist position. I think the academics hospitalist work is very, very helpful to be a GI fellow. If you are already doing the hospice work for a while, and you're not in the academic hospice position, you want to be that position so that you actually show people that you're teaching the residents and you're doing well in that part. Of course, research is very important. Be involved in as many research projects as possible, and go to the national meetings, the GI national meetings, to make yourself known to the faculty. Really know the local GI doctor. If there's a GI fellowship program, you want to know the faculty members there really well. Even if you cannot get into their program, we are all connected. We know each other in all different places. Maybe you have an opportunity to go somewhere to have the training. The other thing, as Dr. Iris Wang mentioned, the non-traditional training year. Hepatology is a big one. It's very helpful, I can tell you. There are also the bariatric medicine year that you can consider. I actually have had a candidate who had a year of IBD training. I tell you that if you have an IBD training, as long as you're not doing bad, you probably will guarantee a position somewhere. So those are the things that you can consider. But if you are not in the GI world, you don't know those opportunities. You have to talk with people in the GI, especially in the GI world. There's a lot of different opportunities for you to build up your resume.
All right. I know we are already past the time of the end of today's talk, and thank you very much for Dr. Wang to type in and reply them in chat. So today's talk, thank you again for both speakers, and really amazing and fruitful talk for today. And I hope that this is also a fruitful experience for everybody today. And we're going to put an end for today. And please do not forget that during DDW, we're going to have our CAGA annual conference. And please contact anyone from CAGA to get further information. All right, and I wish you all a best weekend and take care.
All right, thank you very much. Bye bye.
Thank you again,
For having us.
Dr. Miao, Dr. Wang.